Hello and welcome to Digital Medboard. Here we go. We are observing the right knee joint. Below the right knee joint, there is a common peroneal nerve injury, which occurs due to a fracture lateral to the head or neck of the fibula. The common peroneal nerve has two branches, the superficial peroneal nerve and the deep peroneal nerve. The superficial peroneal nerve is responsible for foot eversion and supplies the peroneus longus and peroneus brevis muscles in the lateral compartment of the leg. The deep peroneal nerve supplies the dorsum of the first rib space with the root value of L5. If the common peroneal nerve, including both superficial and deep branches, is damaged, it leads to sensory loss, primarily affecting the dorsum of the foot. However, the lateral and medial side of the foot remains unaffected because the lateral side of the foot is supplied by the sural nerve. Root value is S1, while the medial side of the foot is supplied by the saphenous nerve. Root value is L4. The deep peroneal nerve is responsible for foot dorsiflexion and toe extension. Damage to this nerve causes foot drop, where the toes fail to clear the ground during the swing phase of walking, resulting in a high stepping gait. We got a question. Fracture of the marked region leads to which type of gait? The marked region is below the right knee joint, which is supplied by the common peroneal nerve. Based on our discussion, damage to the deep peroneal nerve, which is a branch of common peroneal nerve, leads to foot drop, resulting in a high stepping gait. Therefore, option C is the correct answer. If you found this video helpful, don't forget to like, share and subscribe to Digital Medboard. Got questions? Drop them in the comments below. See you in the next video. Until then, stay tuned. Choose.